Really?
And on a personal level, my dad is, and two of my brothers have been diagnosed with prostate cancer in the 50s. So from a personal side,
I see.
that interest. Um, Now, the
Is
thing
that
about,
hereditary? Is that, do you
well,
see signs of that?
well,
Does that concern you?
it concerns me. It concerns me. Um, I'm not sure if it is hereditary or if it's just familial, meaning it is something that is running in my family, but not necessarily being transmitted by a gene
I see.
from one generation to the next. I don't know that for sure. Um, but prostate cancer is one of those controversial topics in medicine. Not every medical group comes out in favor of routinely screening men for prostate cancer.
But also when it troubles, concerns, an elder black man like myself, you never know. You're concerned about when it will hit because many black men do get it.
Right, right. The controversy with prostate cancer is this, that most men with prostate cancer will not die from prostate cancer. Most men with prostate cancer will die from what most people die from, cardiovascular diseases, heart attacks, strokes, heart failure, stuff like that. Nevertheless, people do die from prostate cancer. Um, Going back to screening for prostate cancer, we mentioned the digital rectal exam. There's also the blood test, the prostate specific antigen, or PSA for short. Now, the PSA, when it came into existence, we were diagnosing a lot more men with prostate cancer. Not that the incidence of prostate cancer just went up, but we had a better screening test to diagnose these asymptomatic men with prostate cancer. The problem we have, though, is that the test, the PSA, is elevated not only in prostate cancer, but in other conditions, like just having an enlarged prostate. Also, if you have an infection of the prostate, your PSA will go up.
Which doesn't necessarily mean cancer.
Which does not necessarily mean cancer. Right. Nevertheless, you have a lot of men who end up getting prostate biopsies done because of that elevated PSA, and there's no cancer proven. To add to the controversy, a study that was conducted by the government a few years ago showed that up to 25% of men with prostate cancer proven by biopsy of the prostate had normal PSA values.
Now, also back to those without insurance. Now,
right.
There are those who worry cannot afford to get prostate surgery, and there are a range of different things that be done for the prostate cancer, as I understand it.
Right.
But even with Grady, you're concerned where I have a heart problem. Will I get the same? Back to that question. Will I get the same level of surgical help if I need it, if I don't have the proper insurance?
Well, at Grady Hospital, we have a wide variety of services in all areas. And cardiovascular diseases, we are well represented there in terms of services that are available for patients, right, from preventive cardiology services to invasive procedures, whether it's cardiac bypass, valve surgery, all of that can be done, and patients actually do get those services performed as needed. Okay. Of course, resources are not without limitations. So patients have to be screened properly and make sure that the person who these services are offered to is a good fit. Because not only do you perform the service, but then it's a follow-up afterwards. And the patient has to be prepared to go through the follow-up, the sort of rehabilitation that is needed to make sure that, let's say for instance, you don't want to put a heart valve into someone who is abusing intravenous drugs, who is likely then to get that valve infected and the valve becomes dysfunctional.
I see.
So you have to choose your patients and, you know, have that heart-to-heart talk with the patient. Let them know what it will take for them beyond the surgery to have a decent life and to prolong the life of the device that you put into them.
Dr. Anderson, I'm going to end this interview on one note. Your opinion, please, sir, on the President's health care plan and what that will mean to you as a physician and to the public at large. Is it a good thing? Is it problematic? And do you like it or not?
Overall, I like it. I would have liked if it went further in terms of providing services to cover everyone. Medical care should be something that everyone should have available to them. It should not be those who have money.
Right.
Okay. And I think if the will is there, I think it can be done. You know, the public option that they were trying to get into this first bill, I think would have gone a long way to help get more people in to their primary care doctors, to get the services they need to diagnose conditions early when you're more likely to manage them successfully, and to do those preventive services that might prevent diseases from occurring in the first place. You know, the public service option would have been like, let's say for instance, MARTA.
Right.
It's a low-cost option to allow, at least give the ability for everyone to move around the city.
Sure.
If you don't have a car, yes, it might take a little bit longer. You might have to wait a little bit longer, but you can still get from point A to point B. Somebody else might want to go in style and drive a Rolls Royce, but you're still getting from point A to point B. I don't think the public option would have wiped out competition among the commercial insurers and the government. You know, we have Medicare, we have Medicaid, those are public options now. Mm-hmm. And the commercial insurance are still in business.
Finally, does this bill, as it's now legislated and enacted, does it impact your bottom line, impact your wallet, negatively or positively?
Well, I think that in the long run, it will be positive for doctors. Mm-hmm. Yes, reimbursement may not be what we would like, but I think that there will be more patients who would have insurance coming in. Granted, there are only so many patients that one can see in a day, but I think overall, in the long run, it would be a positive thing for doctors. Thank you.
Appreciate it. I hope I touched on most things you wanted to talk about.
Yes, yes, absolutely.
I find it fascinating you said it really interests you, prostate cancer.
Well,
I see why. Yeah.
You know,
It's
African American men are known to have the highest incidence of prostate cancer. And years ago, I gave a talk at the National Medical Association national meeting here in Atlanta about that. There's actually a researcher, black gentleman, who's doing some fascinating work in prostate cancer, because the PSA does not discriminate as much as we would like it to tell us this person has prostate cancer versus just an enlarged prostate, versus prostatitis. And we need a test that will tell us, yes, you have prostate cancer, but you have the type that is slowly growing and will not cause you any problem, is not likely to cause you any problem in your lifetime. You therefore do not need to undergo these treatments, have your prostate removed and the complications of removing your prostate, which is what most men fear. Because one of the complications of performing that surgery is impotence. And let's face it, no man wants to be impotent.
It's also a consequence of high blood pressure too.
Well, that too. And another complication of the treatment for prostate cancer, if you have the prostatectomy, is urinary incontinence.
Right. Yeah, I heard that. So that's true.
You know, so the impotence and urinary incontinence, those are two of the drawbacks to a lot of men even wanting to be screened.
That's true. That's true. When you hear all horror stories, you hear those things. That's what you hear most about.
Right, right. So
you hear those on the bus more than anything else.
absolutely. So, you know, if there was a marker that would identify those men who have the form of prostate cancer that is going to grow rapidly and is likely to cause their death, then you could be more aggressive with that group.
Right.
And the group that has the slowly growing prostate cancer that probably would never rise to clinical significance in their lifetime, then you could just watch them.
Well, given all this treatment out here now, it's surprising to hear men who die from prostate cancer, given the fact that it's treatable now, right?
Oh.
And it's more than just. Aren't there other treatment forms?
Sure. There are different forms of treatment. You have the prostatectomy, and now they're doing a lot of robotic surgery.
Yeah, that's what I heard. That's the word I heard.
Okay. My brother, he went to Johns Hopkins and had robotic surgery on his prostate. I have patients who have had cryotherapy, which is basically freezing the gland, and by so freezing it, you destroy it. And over time, it will slough and you pass some of the tissue out in your urine. Then there's radiation treatment. You know, you have men who get pellets, radioactive pellets, inserted by the urologist into the prostate that produces local radiation and destroys the cancer.
Dr. David Anderson, we're talking about prostate cancer. We're talking about Grady Hospital and what a lifeline that is. And we're also talking about how high blood pressure, hypertension, all things that impact black men extraordinarily so.